Todos los martes, en punto de las 12, escucha a la doctora Natalia Luragis en su programa En Consulta. Un show que trata de consejos médicos, salud y belleza, y donde la doctora Luragis contesta todas tus preguntas. ¡Comenzamos!
And here we are in Consulta with Dr. Natalia. We have the pleasure to be today with Dr. Eduardo Gonzalez Toledo that works at LSU Ochsner in the radiology department. We are here to discuss something that is being ignored today, that is the fight that we are having against coronavirus. As we all know, we have more than 53 millions of cases of coronavirus in the world and 10 millions in United States of America. We had 250,000 deaths, and they are projecting to have more than 280,000 deaths by the beginning of December. So here we are with Dr. Eduardo Gonzalez Toledo to discuss today the findings that we have in our body that the disease is causing. So it's a pleasure, Dr. Eduardo Gonzalez Toledo, to have you today in our show.
Thank you. Thank you for having me today.
Thank you so much.
Yes. So first of all, I would like to explain how is the virus, how is the morphology of this virus. All these viruses are mainly proteins that go through the surface of the cell and make the cell to produce more viruses. So they change the information of the DNA, and the DNA from our body starts to produce more viruses. Everybody knows the picture now with these spikes. These spikes go to the cellular surface, and they attack the receptors for the ACE, that is the converter enzyme for angiotensin converter enzyme. And these special receptors are in brain, are in the lungs, in the arteries, in the heart, in the kidney, and the intestine. So you see, this virus goes to all these organs, and those are the most affected.
And they produce inflammation
Yes.
as the process.
An inflammatory
Once the
process.
virus attach, they produce inflammation, and that is when we have the symptoms, right?
Yes, and one of the things is that the inflammation, that is the reaction of our own body, is what produces the symptoms. And so the main symptoms are just fatigue and we have
fever. 63%
yes,
of the patients.
we are tired.
Yes.
We have
Muscle
pain, skeletal pain. We can have diarrhea, vomiting.
Yes. We can have a headache. That is one of the most
Yes.
common ones. And we also can get lack of taste and lack of smell, right?
Yes, the lack of smell is quite characteristic because of the virus goes into the nasal cavity, and the roof of the nasal cavity limits with the brain, directly with the
right here.
Yes, right here, and goes through the olfactory nerve. The olfactory nerve has a small nerve fibers through the what is called the lamina cribosa, and the virus goes there and goes into the olfactory nerve. So
producing the headache, producing the lack of taste, producing the lack of smell. That is why it's so important for our patients, when they are using the mask, cover your nose, because remember, the virus is penetrating your body through the nasal cavity, right?
Yes. So when you start having shortness of breath and just you cannot breathe, this is already severe symptoms.
Exactly.
And we can show a CT of the chest where you see horizontal slices, transverse slices through the chest, and you have 3 of them with a blue area, a white area in the lung. On the right, in the bottom, there is one that says normal. This is how you have to see a normal
lungs.
CT.
Exactly.
The lung appears black.
Exactly, because it's full of air.
Yes. So you lose the air in the lung. So you cannot breathe. You don't receive oxygen. All the tissues need oxygen to survive.
Exactly.
So
because the virus is producing the destruction of the alveoli, that is the cell that is producing oxygen by the mechanism that Dr. Eduardo Gonzalez Toledo just explained to us. So what we see, what is it, doctor, that we see that is like white? Is it like a pulmonary embolism?
It's an inflammatory process. There is kind of water, like when you have a swelling knee because you have a trauma.
Exactly.
Then you have a swelling. You have an infiltrate of cells that trying to repair
the damage
they have.
Exactly.
They produce more problems. Yes. And so this is what happens in the lung. Because it involves the vessels. We have the wall of the vessels. We can have hemorrhages. We can have obstruction of the vessel that is producing infarction.
Exactly.
And so this is because of this affinity of the brain to the ACE enzyme. You see?
Yes. That's a pathophysiology that we were explaining at the beginning of the show, right?
Yes, that's why.
And also something that we did say already when we were filming in Spanish, we are filming the second time in English now, is that sometimes a person can be diagnosed with coronavirus. They can go to their house, they can think, I'm getting better, and day number 7 is the day that is super critical in a patient with coronavirus, because it could be that they get better, or it could be that all these inflammatory markers that we were talking about start getting worse. That's when a patient has to maybe go to an urgent care or to an emergency room or to the hospital to do all these markers, like a D-dimer, like an LDH, like a ferritin, like a CBC, like a C-reactive protein, to see how much inflammation they have in their body. Sometimes they can be in kidney failure, sometimes they can be in liver failure. The virus can produce destruction in multiple organs, not only just the lungs. Once the patient reach that point is what we can see in the pictures.
Yes.
That sometimes, like Dr. Gonzalez Toledo was explaining to us, they need to be intubated, or they need supportive oxygen, or they need an oxygen mask, not just nasal cannula.
Yeah.
And things can get worse and worse, right?
Yes. You can see in this slide the slices of the head, and white areas, those are hemorrhages, multiple hemorrhages in a patient with COVID. And
how old is this dog?
This is 39-year-old patient.
Really young.
Yes. We have a lot of young patients, even kids. You see, it's not that generally they say, no, kids is really mild. No, they can have severe problems.
An organ failure.
Yes,
as well.
they can have encephalitis. The inflammatory process in the brain.
Yes.
They can go to a coma with that.
That's crazy.
Yes, and also what you will see in this other patient, around 40 years old, is an infarct is the black area, and has also a hematoma outside the brain, so a subdural hematoma. And this is explained for this abnormality in the vessels. They obstruct the vessels, and also they open the vessel. They produce hemorrhages.
Dr. Toledo, is
Yes.
it like also that it could give us like little strokes? Like what are the symptoms on these
this
patients?
is a really stroke.
Exactly.
The patient will have, in this case, right hemiplegia and aphasia. That is the incapacity to pronounce words.
So the patient cannot talk
Yeah.
and cannot move the
Yes.
right side. And
Yes.
this is a patient that, how old is this
Is
patient?
40.
40 years old.
Yeah.
So young people can also get really sick from this disease, even though they don't have comorbidities.
Yeah.
Let's remember that patients that are overweight, that is most of the population in this country, have a worse outcome. So obesity is a risk factor because, we have our belly, and the belly is producing us not to be able to breathe as well because we cannot move our lungs. So it could be that they go into a respiratory failure a little bit easier, and they can have also these complications, right?
Yes. And the problem is that also the kidney is an important factor because the patient is improving and suddenly develops a renal failure.
Exactly.
And they die because of that. And also the heart. There are multiple problems with heart. They have arrhythmias, they may have an infarction, and this is not only, the patient may feel okay or with not very severe symptoms, but after some time develops a release of what is called cytokines.
Yeah.
These are chemical factors that produce the cellular death, finally.
And they produce all this chaos in all our body. So we're going to go into a little bit of commercials right now, and when we're coming back, Dr. Gonzalez Toledo is going to share some information and a study that has not been published yet, and it's the explanation of one of our symptoms that we have with coronavirus. So please stay, share this video, let's help each other to educate, and again, let's recognize this disease so we can fight it together.
Desde Shreveport, 318 Latino.
There is a place where you can dare to dream, find lasting friendships, and a place to belong, where you can find your calling and change the world one step at a time, where you can find yourself, where you can find your anchor.
Kingston Neighborhood Market is rocking with their amazing tacos and deli department. If you don't feel like cooking today, come see us at 5604 Benton Road.
Kingston's Neighborhood Market, keeping you close to home.
El Compadre Mexican Restaurant would like to thank the community for your love and support. We are here ready to continue serving with the best we can cook for you. El Compadre Mexican Restaurant, 502 East Kings Highway in Shreveport.
318 Latino. Por internet desde Shreveport.
Here we're back, and as I said, we're here with Dr. Eduardo Gonzalez Toledo, who is going to explain us the physiologic mechanism of our lack of smell. Why, when we have coronavirus, we cannot smell?
Yes. So at Oxnard LSU, we have a special software and a special that we examine our patient. It's not research. This is a clinical examination that I can share with you how we can explain why the patient has anosmia, that is loss of the smell. In the first, we have a reconstruction of the brain in 3 dimensions from a magnetic resonance examination. On the left, the software recognizes all the gyri in the brain, all the anfractuosities and pains in different colors. This is on the left. On the right, we can see the cortex. So the software measures the cortex and puts in different colors. Red would be the normal cortex. So in the upper portion of this image, you see a blue areas that is in the surface, in the inferior surface of the brain, adjacent to the roof of the nose, of the nasal cavity. And this means that this area has an inflammatory process. Then we measure what is called diffusion tensor imaging. In diffusion tensor imaging, we have the measurement of the axons. That is like in a cable, you have a central portion, the wire, but is surrounded by an insulator. In the nerves, the wire is called the axon, and the insulator is the myelin. It's a lipoprotein. And in this case, we see that there is abnormality in the axon and the myelin with 2 different measurements. One is called parallel diffusivity, and the other is perpendicular diffusivity. And then we perform a functional magnetic resonance. And in the functional, you select an area to explore that you see there in red and in orange, in deep orange. And then on the side, you see an area of blue. This area, blue area, is in the olfactory nerve and is the result of the comparison of our patient with normal patients. When the activity is decreased, you see blue. When the activity is increased, you see red. In this case, you see blue because there is decreased connectivity in the area of the olfactory nerve. In the bottom images, you have 2 images. One on the left that points to the olfactory nerve, that is decreased connectivity in the olfactory nerve. And on the right, you see a spot, a blue spot, in the what is called the posterior cingulate gyrus. The posterior cingulate gyrus is corresponds to what is called the limbic system, is the emotional system of the brain. When we have some sensation, it is filtered by the emotional system in this area. So you feel pain, you feel whatever sensation is filtered to this emotional area. So there is a problem not only with the primary area of the olfactory cortex, but also with the emotional sensation. And so this is one of the patients. So this is not a research thing.
Study, exactly.
It is a clinical
finding in one of the
finding.
patients.
Yes, we had it in some patients.
Exactly.
We will try to gather information. Yeah, we have to ask for permission to the IRB, to the Institutional Review Board, and then we will collect our cases and we ask the patients to give permission to do this, no?
Exactly. But this is like one of the examples of the reason why we have this like lack of smell, right?
Yes.
And also, this is such a great opportunity for us to recognize this disease, for us to show in pictures of the lungs, of the brain, of all the different things that the disease can give us and what we can do as a community in Shreveport, Louisiana, to decrease our cases of coronavirus. One, let's educate each other, let's help each other, and let's remind each other, let's use the mask, let's cover our nose, like Dr. Gonzalez Toledo just explained. This is the entrance of the virus to your brain. That's why you get the headache. That's why you get the lack of taste, the lack of smell. It can go to your lungs. It can go to your kidneys, to your liver. Let's use that hand sanitizer. Let's remember to sanitize our hands as much as we can. Let's use the mask for us, for our community, for our kids, as mothers and parents. Let's set healthy boundaries to the gathering of our kids in public spaces, and let's have this kind reminder just before Thanksgiving of the things that we can do to be without the disease. We can take vitamin D, 5,000 international units tablets daily. We can take vitamin C, 1,000 tablet daily. We can take zinc if we don't have any contraindications from our doctors. We can have a thermometer at home to check our temperature if we don't feel okay. We can have a supply of Tylenol if our temperature is more than 100.6. We can take one. And the most important one, guys, let's have a primary care doctor that you can text, that you are in touch with, and say, Dr. Natalia, I don't feel okay today. I'm having muscle pains. I'm having a headache. I lost my taste. I lost my smell. What should I do next? This is so important to have guidance through your primary care doctor. We also have all the places that 318 Latino shares weekly where the test is done for free for all the patients that do not have health insurance and do not have the extra money to go to the urgent care and maybe pay $2,000. So now, Dr. Gonzalez Toledo, please, if you can close the show today with your amazing knowledge and recommendations for our community just before Thanksgiving.
Yes, we got rid of poliomyelitis. That when I was a kid, I couldn't go outside. My parents were worried because of having the poliomyelitis, and was defeated because of this care. And also when the vaccine appeared, and now is no longer a threat. This will happen with the coronavirus, we hope. But you have to remember that not using a mask, not practicing social distance, will not only affect you, but will affect your family, family, your neighbors. You have to go to the intensive care unit in the hospital and watching young people dying with this incapacity to breathe is very, very, very bad, very bad symptoms that you have to understand that maybe you can avoid only with these measures, as you said. That's washing hands, using the mask, trying to practice social distance. And I think this is finally we will get rid of this disease.
And we will pray for a vaccine, hopefully soon to come. But as we see all this map in red, we have 53 million cases in the world, 10 million cases are right here in this country, the United States. So let's recognize this disease. Let's recognize the amazing job that the healthcare workers are doing, nurses, doctors, everybody in the healthcare is putting their life, is putting their effort to fight the disease. So let's help as a community to do the same. So with that, we wish you a happy Thanksgiving, and we hope that you're using your mask and washing your hands as much as you can. Have a beautiful day, guys.
318 Latino por internet desde Shreveport.